If you or a friend have felt that youth mental health is reaching a critical point, you aren't imagining it. Today, we're looking directly at the data that tells us about pediatric emergency room trends, and more importantly, what teens, parents, and communities can do to actually help. In 2021, leading pediatric health organizations declared an official national state of emergency in children's mental health. But what is driving these emergency room numbers, and how do we get here? A landmark study analyzing national data from 2011 to 2020 found that while total pediatric emergency room visits stayed flat, the proportion of mental health visits nearly doubled, rising from 7.7% to 13.1%. That represents an increase from 4.5 million to 7.5 million ER visits. Even more concerning, suicide-related ER visits increased fivefold during that decade, with the highest surge seen in kids aged 10 to 14. We also saw an increase in complexity, with a lot of young people presented with multiple mental health diagnoses. During the COVID-19 pandemic, these trends accelerated. Adolescent females were disproportionately affected with ER visits for depression, eating disorders, tic disorders, and OCD, rising all the way through 2022. Furthermore, ERs face severe resource strains. By 2022, nearly 20% of youth mental health visits involved prolonged boarding times exceeding 12 hours. The median stay for a mental health visit reached 17 hours compared to around 5 hours for non-mental health visits. However, fewer than 20% of these visits involved an evaluation by a mental health professional, showing major workforce shortages. Why are so many young people turning to emergency rooms? Well, research shows it's a combination of several factors. Between 2009 and 2019, high school students reported persistent sadness or hopelessness growing by about 40%. Adolescents seen spending over 3 hours a day on social media also face a higher risk of depression and anxiety, and addictive screen use is tied to a twofold higher increased risk of suicidal behaviors. There are also significant outpatient shortages. The average wait time for a first child psychiatry appointment is nearly 43 days, forcing many families to use the ER as a safety net. There's also social issues too. Adolescents in low opportunity neighborhoods have nearly 75% higher rates of mental health ER visits compared to higher opportunity and upperly mobile areas. On a positive note, reduced stigma and better screening means families are more proactive about seeking help. So how do we prevent mental health crises before they reach an emergency room visit? Well, for adolescents, first of all, regular sleep, physical activity, and balanced nutrition are foundational tools for depression management. Set screen boundaries, limit social media time, especially before bed. And evidence-based school programs like Signs of Suicide and Sources of Strength help build resilience, peer support, and coping skills. For parents, build strong connections with your child, maintain open relationships, support teen autonomy, and minimize household conflict as best as you can. And consider establishing tech-free zones. Create screen-free areas at home to protect sleep and foster face-to-face interaction, especially at the dinner table. And most importantly, watch for warning signs. Stay vigilant about persistent sadness, social withdrawal, and giving away possessions, all signs of suicidality. For community leaders, health guidelines recommended routine depression screening for adolescents aged 12 to 18 during regular checkups. Clinic models that also embed mental health specialists directly into primary care have been shown to reduce youth mental health ER visits by 25% and hospital admissions by 50%. Addressing this crisis requires effort at every level, from individual self-care to broader systemic access. If you or somebody you know is in distress and experiencing a mental health emergency, you don't have to face it alone. You can call or text 388 to reach the Suicide and Crisis Lifeline 24/7 and reach out to mobile crisis teams and school counselors. Together, we can build supportive environments for every young person. Stay safe out there and make good choices.